Stop me if you've heard this one before, but a pharmaceutical company has developed a new drug targeted at a specific problem in pets, and within months it's being dosed by the millions across the world. A veterinary tale as old as time. In this video, I want to talk to you guys about a new drug that your dog may be receiving, and that is bedenvetmab, better known as Librela. This medication very recently hit the market and is designed to treat arthritis in dogs through mechanisms that I'll go over in the video. However, despite the reported safety and efficacy by both the manufacturer and veterinarians the world over, there are some side effects this drug may have that, in my opinion, are not talked about nearly enough. We'll also talk about the very limited amount of research used to obtain FDA approval for this drug. Finally, we'll discuss how you, the pet owner, can navigate the decision-making process regarding whether or not to give your pet this medication. Before I do that, team, please hit that like and subscribe button. I get a lot of views from my videos from people that are not subscribed to this channel, so please, if you like my content, consider subscribing. It is free after all. Now let's begin. First, let's talk about this new drug, Librela, and why it's been created and how it works. So Librela was created in order to address a very common problem in pets, and that is arthritis. More specifically, it was created to address chronic pain that results from arthritis. Now, arthritis in pets has a huge impact on their quality of life. It is estimated that 20% of dogs in the US over the age of 1 have some degree of arthritis, which is a lot when you consider the fact that there are over 60 million households in the US that contain a dog. Arthritis oftentimes occurs without an obvious explanation, but it is more commonly associated with other problems like obesity and trauma and other orthopedic injuries, malformed anatomy like hip and elbow dysplasia, or sometimes autoimmune or infectious diseases. Now, regardless of cause, the fact remains that there are a lot of arthritic pets that are in pain and immobile across the world. Also important to note is the impact this has on pet owner welfare. The husbandry and costs of managing a pet with arthritis can be immense. To give you an idea of the costs in play here, a study way back in 2005 found that the total cost of surgically treating one of the most common causes of arthritis in dogs, that being a cruciate ligament tear, basically the dog version of an ACL, across the US was $1.32 billion. This is back in 2005, and this is just one possible cause of arthritis. Currently, vets employ all sorts of tools to try and help treat arthritis, ranging from anti-inflammatory meds like NSAIDs, this is your carprofen or Rimadyl, Metacam, and the like, pain medications like gabapentin, steroids, or non-medical treatments like joint supplements, more on those later, physical therapy, acupuncture, and yes, animal chiropractic. These treatments only go so far, or in the case of chiropractic, nowhere, all while costing pet owners many, many dollars. So you can get the idea that there's an enormous need for some new strategies to help treat arthritis in pets. Enter bedenvetmab, aka Librela, and no, I'm not 100% sure I'm pronouncing bedenvetmab correctly. This drug is what's called a monoclonal antibody. Monoclonal antibodies are antibodies created in a lab that, when injected into the body, will target specific proteins and inhibit the actions of those proteins. Now, it's way more detailed than that, but for the purposes of this video, that's what they do. If you want a more detailed description of monoclonal antibodies, you can check out this paper. I'll link it in the description. In the case of Librela, Librela is designed to bind to a protein called nerve growth factor, or NGF. NGF is important because it has been shown to be responsible in large part for the chronic pain that occurs from arthritis. How nerve growth factor does this is complicated, but I'll summarize it right now. Nerve growth factor is a protein whose major role is to repair neurons, help them function normally, help them divide and grow, hence the name. NGF plays an important role in both the central and the peripheral nervous system because it basically is the body's way of maintaining a healthy, functioning nervous system. Now, if you want a nice review of NGF, here is a great article I found on PubMed, but the take-home message for nerve growth factor here is the nervous system needs this protein in order to maintain itself. Keep this in mind as we move forward here. Now, included in this population of nerves that are helped by nerve growth factor are sensory nerves, whose job is to detect and transmit pain signals from injured areas of the body, such as, say, an arthritic joint, to the brain. When a joint is chronically inflamed, the sensory nerves in and around that painful area will upregulate themselves due to the injured tissue remaining there unresolved. This is the body's way of saying, hey, there's something not right here, it's not getting better, and you need to pay attention to whatever's happening here. This propagation of pain-sensing nerves can eventually do more harm than good, because more nerves detecting more pain means more pain for a dog or cat to experience. I think of it like one of those outdoor bug catcher lights where bugs are attracted to light and they keep coming towards it without end until the light goes off. The bugs in this case are pain-detecting nerves, and the light is the source of the pain. Librela seeks to remove the bugs, but not the light in this analogy. So the thought process here, again, is we can give a drug like Librela that binds to and inhibits nerve growth factor, and then that will reduce the amount of pain experienced from chronic arthritis. Seems plausible on the surface, and in fact, well over a decade ago, these nerve growth factor inhibiting drugs were developed for people suffering from chronic arthritis. A drug called tanezumab, again, I may or may not be pronouncing this right, but tanezumab was one such drug developed by Pfizer almost 20 years ago. It was evaluated through multiple clinical trials, but ultimately was not approved by the FDA due to safety concerns. Ultimately, Pfizer discontinued production of the drug in 2021. In these trials, while some results were promising, ultimately they were stopped due to a high frequency of two major adverse events. One being rapidly progressing arthritis, that means arthritis getting a lot worse, and neuropathy. The FDA also concluded that there was no evidence of tanezumab being superior over NSAIDs, anti-inflammatories, by themselves. In another study published in 2016 that looked at side effects of tanezumab, the authors hypothesized various reasons for why an arthritic joint would rapidly worsen after giving this medication. They mentioned mechanisms like neuropathic arthropathy, which is essentially joint damage itself occurring secondary to malfunctioning nerves. They also mentioned another mechanism called analgesic arthropathy, which is essentially overuse of an injured joint as a result of good pain relief. Now, it should be noted that these are not proven to have occurred in people who took part in these trials, but these are hypothesized reasons as to why some participants' arthritis worsened so much following treatment. Now, I mentioned all this human clinical trial data just for you to keep in mind as we move forward talking about Librela for dogs. Again, the FDA would not approve this medication due to safety concerns in people. Now, Librela itself was designed by a pharmaceutical company that you may know called Zoetis. Zoetis was a subsidiary of Pfizer up until 2013. The drug was approved by the FDA in 2023 and has rather quickly become a very popular tool amongst veterinarians to help treat dogs with arthritis. The first question you may be asking yourself is, how did the human version fail while the dog and cat versions got rapid approval? There must be a lot of evidence that this works in dogs, right? Well, let's take a look. The FDA approved Librela based on evidence provided by two field studies, one in the US and another in the EU. This is technically two studies, but in reality, it's the same study in two different geographical places, but those are semantics, I guess. Both studies were randomized, double-blinded, and placebo-controlled. Good there. The studies looked at dogs with arthritis diagnosed through exam and x-rays and divided affected dogs into a control group that received sterile saline injections and a treatment group that received Librela injections. Now, here's the most important part. The way in which these dogs' pain was measured was an owner-based survey called the Canine Brief Pain Inventory, or CBPI. This is an owner-provided survey of 10 questions, each on a scale of 1 to 10, that determine the level of pain and extent to which pain interferes with a dog's life. This survey was filled out by each study dog's owner at various time points in both studies. According to the published results, both studies showed a significant improvement in the treatment groups, as evident by lower pain scores. This graph right here shows a nice visual summary of the results. This is from the US study. The EU study has a similar appearing graph. So on the headline, the surface level here, it looks like there's some research to demonstrate effectiveness of this drug, but this is only two studies, and it's very important to point out the researchers of both of these studies are employed by Zoetis. It says so right there at the end of both papers. I personally find it a little bit disappointing that all the FDA needs is apparently two studies funded by the parent company of the drug to approve what I would consider to be a novel medication such as Librela. Furthermore, I have some concerns about the methodology used in these two studies. For one, the pain scores are a subjective measure assessed by the dog's owner, not an objective measure of pain or ability to use a limb. Objective measures would be something like a force plate analysis, where a dog walks on a surface and that surface measures how much force they're putting down onto the plate to determine the extent to which they're using each limb. This is commonly used in animal studies focused on lameness or other problems affecting the use of their limbs while walking or standing. But the study used instead what I would consider to be a very subjective measure. Let me illustrate to you why this pain scale is problematic to draw conclusions from. Let's say you're a pet owner in the study and you're asked to fill out this survey of 10 questions with each ranging from 1 to 10. You're looking at your dog, looking at these numbers, you're not sure where the dog falls on this range. You figure, well, it's probably not a 0, all things considered, and it's probably not a 9 or a 10 because it doesn't seem extreme per se. I don't know, maybe let's just say it's a 4 or 5. Then your dog gets an injection that you don't know is placebo or the actual drug being studied. You come back in a couple weeks and you fill out the survey again. Your dog's been receiving other medications during this time too, other treatments. You fill out the survey and you think, yeah, I mean, things are a little bit better. Fluffy seems happier. Fluffy chased a rabbit the other day. I'll put a 3 now. You see how subjective this can be. And you also see how this would be a perfect recipe for what's called response bias to be occurring all over the study. I think you can even see this effect play out in the graphs provided in the study. Just look at how the placebo line in this graph steadily declines with time and follows a very similar overall shape compared to the treatment group. Furthermore, we're really only looking at about 1 to 1.5 steps down on this pain scale here. I wouldn't describe this as all that dramatic of an improvement, especially because the source of these data points are an owner survey. And it appears as though the placebo group started off with a higher pain score to begin with, so it stands to reason those patients might have more severe disease starting out. So just to review, the FDA approved the use of this medication thanks to a grand total of 2 studies, which again were really just the same study in 2 different locations, with data that came from owners filling out a survey of how they think their dog is doing. And that's all we need for full FDA approval and widespread administration to millions of dogs across the world now? Okay. Now remember, with humans, the FDA didn't approve the tanezumab medication due to 2 toxicities identified in the clinical trials. These toxicities were identified as joint destruction and neuropathy. In the aforementioned veterinary studies, a number of dogs were withdrawn due to adverse events. Some events have no real connection to Librela and how the medication works, stuff like testicular tumors. I can't really draw a conclusion there. However, you do see some dogs withdrawn due to, again, worsening clinical signs of arthritis or worsening neurologic function. Now, in any study like this, you're going to have some dogs have to withdraw because with any population of dogs, they're going to develop some symptom or some disease just sporadically that will affect whether or not they can stay in the study. I'm not saying these dogs were killed by Librela per se. All I'm saying is, why doesn't the FDA take a little bit more of a cautious approach on this and wait for more evidence to come out before just approving it? As far as safety of the drug goes, the package insert describes a safety study whereby the drug was given to 1-year-old healthy beagles. And this is important to demonstrate, obviously, because it doesn't really reflect, in my mind, a clinical population at all, because the vast majority of dogs, if not every dog, receiving this medication is going to have comorbidities of some kind. In a market research study published by Zoetis in the EU, veterinarians administering this drug listed the following comorbidities in their patients shown in this graph. You can see none of these dogs reportedly had neurologic disease of any kind listed out of almost 2,000 dogs. I find that hard to believe, and it does make me wonder if underlying neurologic disease is being missed in some patients either through failure to recognize it, which is a real thing that happens, or by just attributing neurologic dysfunction to arthritis. Again, this happens all the time in real life. So 10,000-foot view here, we're given a drug that inhibits nerve growth factor in an effort to combat the pain caused by arthritis, not treating the arthritis itself, just the pain. The question is, does inhibiting nerve growth factor help a dog or cat or person more than it hurts? If you inhibit nerve growth factor, will that make it harder for a dog with neurologic disease to function because their nervous system is already damaged and taxed by a disease, and now the body's own nerve growth factor can't even do its job to repair the nervous system? In other words, will this medication potentially worsen underlying neurologic function? I recently went to AVMA over the summer. This is a giant conference of veterinarians. Listened to a talk put on by a rep from Zoetis talking about the development of Librela and its use so far. The speaker did mention that some dogs seem to have neurologic dysfunction revealing itself after Librela injections, but the reason why, as mentioned by the speaker, frankly disappointed me. They claimed that in some cases dogs have both underlying neurologic disease and at the same time really bad arthritis that masks their underlying neurologic disease. The Zoetis team posited that Librela can sometimes resolve the arthritis pain issue and then unmask underlying neurologic disease. I think this is completely unfounded, and frankly, it's kind of a bullshit thing to say. For me personally, as a practicing neurologist, I don't think I've ever seen in my career a dog with neurologic dysfunction and arthritis at the same time, where the arthritis was so bad that I couldn't detect any level of neurologic dysfunction occurring concurrently. I actually asked the Zoetis rep during the Q&A if, based on the mechanism of action of this drug, inhibiting nerve growth factor, and the fact that some dogs were showing neurologic deterioration after receiving it, if rather than unmasking neurologic disease, the drug could actually be harming their nervous systems. I was told no, and then the speaker said, "Sorry, I'm being told we're out of time." And I didn't actually see anybody saying that. Now, another rep spoke to me on the side after the talk, and this other rep did acknowledge that there just isn't enough information out there to fully know whether or not pets with neuro disease may worsen when given Librela. I got the distinct impression that this question of neurologic disease is not something that Zoetis is prepared to really address at the moment. I think in cases of pets developing neurologic deficits following Librela injections, you have to at least consider the possibility that by inhibiting this important peptide, nerve growth factor, you might be exacerbating neurologic dysfunction. Now, to Zoetis' credit, they do list a number that you can call to report possible side effects of Librela or its analog in cats, Solensia. I'll post that right here. So what should you, the pet owner, be thinking about when faced with the possibility of giving this drug to your pet? I can't tell you, the individual, what to do in a video, obviously, but here are some things I consider when evaluating patients I see in real life. First, I would make sure that your pet does not have any symptoms of neurologic dysfunction whatsoever. This may require a consultation with somebody like me, a neurologist, and I know we can be difficult to find because there's only like 300 of us in the world. I personally, just me, would not give this medication to a dog with neurologic dysfunction. Symptoms of neurologic dysfunction include mainly weakness, incoordination, and pain. But these symptoms can manifest in ways that make it hard to differentiate from orthopedic problems like arthritis. There's a lot of overlap in the clinical signs. And they can also look a lot like what Zoetis presents in a client handout showing people what symptoms of arthritis look like. Again, the take-home message here being it can all kind of look the same to the untrained eye. If you and your vet have good confidence that your dog's problems are arthritis related and not due to neurologic dysfunction, discuss the use of medication like carprofen or other non-steroidal anti-inflammatory drugs, pain meds like gabapentin, and employ the use of physical therapy measures like laser, acupuncture, water treadmill, alongside stuff like weight management and lifestyle modification. Please notice I did not mention chiropractic. Something else to consider would be omega-3 enriched diets and omega-3 supplements, possibly CBD oil. Based on the findings of this 2022 meta-analysis, I would not waste my money on glucosamine chondroitin nutraceuticals because this meta-analysis found, quote unquote, a marked non-effect of these products. This is also just a good review in general, and I would encourage anybody to read who's interested in this topic of animal arthritis. Now, if those measures didn't work and your pet's quality of life was severely impacted and they had no history or current signs of neurologic dysfunction, I would consider giving this medication knowing full well one of those two adverse events could occur: worsening arthritis or worsening neurologic function. If you are unsure if your dog has neurologic deficits, have them checked by your vet, and if your vet isn't sure, ask for a referral to a neurologist, or if one isn't available, a board-certified surgeon near you. Surgeons can sometimes stumble their way into evaluating neurologic disease. That's a little bit of surgeon-neurologist humor there for you. And one final note, in making this video, I really am trying to walk the line between evidence-based concern and anecdote-based hysteria. I want to formally separate myself from the various Facebook groups that have people claiming all sorts of illness and death alongside this medication. If you do browse around one of these groups and somebody claims that Librela killed their dog, just remember that each case has to be individually analyzed, and a full post-mortem exam, i.e. necropsy, has to be done before you can even consider a causal link between this drug and serious illness or death. I can and probably should do an entire video on some of these Facebook groups out there, but just know correlation and causation are two separate things. All right, team, that's enough for this video. That's enough of me talking into a camera. If you've given your dog Librela or your cat Solensia and you'd like to share your experiences therein, good or bad, please leave a comment below. And remember, if you have questions or concerns, please talk to your vet about whether or not giving Librela makes sense for your dog. Take it easy, everybody. Peace out. We'll see you in the next video.